Welcome to Free Flow, the Health Tech Law and Policy podcast, where we explore developments in health policy and help you navigate legal and compliance issues that affect your business. I'm your host, Dan Orenstein. In today's episode, we're joined by Ben Klein and Katie Wise, both founders of Red and Blue Strategies, who will help us understand what's going on at federal health agencies and how these developments will affect health tech companies. Before starting Red and Blue Strategies, Ben led a specialty practice at a top lobbying firm and has worked in leadership roles in the Senate as well as public health organizations, including the American Cancer Society and the American Heart Association. Katie co-chaired the healthcare practice at a large government relations and communications firm. She has led lobbying efforts for the Federation of American Hospitals and previously held major positions in several House Republican offices. Hello. Welcome to Free Flow. Hi, Ben and Katie.
Hello.
How's it going today? You are our first guest on the show, and really happy to have you. We've worked together on policy issues before. Are you both in D.C. today, or D.C. area?
Yes, we are both in D.C. We are right next door to each other, actually.
Terrific. We're making the technology work. It's a miracle. So I'd like to just, before we get going into the world of policy and health tech, I just wanted to, share some stories about you guys and, share a few personal anecdotes just so people can know you a little bit better. So, we worked on a bunch of government relations work when I was at Health Catalyst. And at one point, Ben, you had an opportunity to come out here to Park City and ski our wonderful snow here. And I was really impressed as, you never know how someone visiting Park City is going to show up to the mountain, but you came with like homemade skis and these poles with big baskets, and you're a really good skier. We did a lot of fun runs. Maybe you can just tell me a little bit about your ski company.
Yes, I'll use company in quotation marks.
Your skis are right in this office, right here.
Yeah, we could do show and tell. Somewhere in 2019, a friend of mine was just getting ready to leave the Air Force, and we both do a ton of skiing together, and we're talking about it would be fun to try to make skis, and we found a kit online, and we possibly consumed a few beer and ordered the kit.
Nice.
Made our first pair, and then from there we started to do everything by scratch, and so we are now the largest ski company in Virginia, probably in the South.
And that's a high bar, right?
That is a very high bar. It's a very elite club, but it's a ton of fun. It's a good escape from how I spend my day job, and it's fun to actually make something. Sometimes it's hard to see the direct impact of our work day to day. When you're making skis, you can actually, from the morning to the afternoon, you see your progress. And so
it sounds like a fun craft.
It is.
It's like the taking out the trash effect. I always tell Ben how much I love trash night because it's like, you accomplish it in this like moment in time and it feels so good.
You actually accomplish something tangible, right? And you have a name for your ski company, am I right?
Yes, it is Powder Saw Skis. So you can check us out on Instagram.
Awesome. And how is production? How's the factory these days? And the workers and everything.
It's a little slow
morale
this season, but we're gonna get going. My friend who I make them with just dropped off his son at college, so we have some more time now the fall to get ready for the winter, but we try to make probably 5 to 6 pairs a year. So it's a limited number each year.
Nice. Okay. You've got to be an elite group to get a pair of those skis, but I will attest that they work really well. And at least for you, Ben, you really showed up on the mountain. So Katie, I think you've got some athletic pursuits as well. I know that, in DC, politics and policy advising can be a very competitive endeavor, but maybe you could talk about the sport that you've kind of revisited lately.
Yeah. Unlike Ben, I'm not a 2-time founder. So, he wins there. He's actually going to showcase his skis tomorrow on the hill. And
really? Okay.
Oh, yeah.
Who are you showing him to?
The National Ski Area Association has a reception on the hill, so they've invited me to bring some skis to put out, which are now hanging out in the office Katie's in.
he's forcing me to be an employee
That's
of
right.
Powder Sauce Ski tomorrow, but for free.
Oh, nice. An
So,
employee in quotes.
yes.
Intern.
Okay.
But yes, I think in DC, like having a competitive nature is pretty normal. Ben and I love to win on behalf of our clients. It's actually why we went out on our own and started Red Plus Blue, which we can talk about. But I played a sport in college. I played tennis in college and gave it a really long break, nearly a decade later. I picked up a racket and I play on a team and I'm really loving it. It's like,
Sweet. Do
I
you
don't
do
know,
doubles or singles?
doubles, which I played singles in college. So it's a little bit of a different skill, but I'm really finding joy. Like I took a lot of time off because I was done post college, but I have picked it back up and like I find myself trying to figure out like how I can play tennis every day, which really isn't possible, but it would be ideal,
Yeah.
if I didn't have a 9 to 5 or more than a 9 to 5, honestly.
Yeah, that's great. So yeah, you're both pursuing those things, and I love, Ben, how you fit an association in Washington into the ski conversation. Only in
Yeah.
DC
Yes,
do you
it is a
get like an
very
There's an
association
association
in
for
that
everything.
conversation. But yeah, so you guys recently launched your own, or you went in with some partners in Red and Blue Strategies. Maybe just hum a few bars on that. What are you guys doing? What are you trying to accomplish?
Ben, go ahead. You start.
Sure. So yes, there are four of us, two Democrats, two Republicans, and I think, we came together in April to kick off Red and Blue Strategies with the goal of doing our best work for clients. I think, Katie and I, as she said, we love winning for clients. We also like being extensions of our client teams, and we've had an opportunity to work together for I think 8 years and have a very similar style for how we like to approach client work and wanted to do so in a small setting where we can be all in. We can work on a limited number of projects and really get stuff done. And so it's been a great run so far, and really enjoy the
That's
partnership
great.
that
When
we
did you
built.
guys launch that or get into the partnership?
February,
Okay, terrific. Okay, so
right? Is
um,
that right, Ben?
That is right.
okay,
It
you've
feels
had a
like,
little run.
yeah, it feels like it is just a real extension. I think Dan, you worked with us when we were at a much larger firm, and Ben and I ran our healthcare practice out of that firm. Learned a lot, got to work with some really amazing companies. Yours included at the time, Health Catalyst, and decided that we wanted to go out on our own, really be selective about the individuals and the companies that we work for, and so we get to do that as four partners,
That's awesome.
and we're looking to grow, so
And
it's
you
going well.
are one of the pairs of R&D in the Red and Blue, the two of you. And so Katie, you're the R, Ben, you're the D. So let me just ask you, because we've got so much noise in the political and media space about about division and siloing and um, healthcare seems to me to be one of these areas where there is a fair amount of bipartisan agreement on good policy to improve patient access, treatment, improve technology, reduce cost, all of those things. They don't all have a partisan angle to them. What are your thoughts on it? Is like, can bipartisanship live in this area, or are things so divided that it just seeps into that as well?
I think that there's actually a lot of bipartisan work happening. It just oftentimes doesn't get covered by the
It
press
doesn't
or picked
get to
up.
be part of the news cycle.
But and sometimes it's hard to do really big, bold proposals in a bipartisan way, but there are a lot of small incremental improvements that are happening in the healthcare space where members on both sides are coming together. And we certainly see that in the health tech space. On issues like AI, interoperability, it is a very different conversation than if you're talking about, the Affordable Care Act, which tends to break down on party lines.
Right. Right. Because that has to do with how coverage for healthcare is structured and paid for. And you get into more of the political issues there. Yeah.
Yeah, but even that, I mean, Ben and I work on behalf of a whole host of different types of clients, not just in the healthcare tech space, but more traditional healthcare. And Ben and our team, we work on behalf of all of our clients in a bipartisan way. And so even issues within the ACA, While the ACA, the inception of it seems very inherently political, it's been around for 15 years. And so there
Right.
are Republicans and Democrats who feel very strongly about the coverage in which their constituents receive. And that continues to be, how do we make it better? And I think you're seeing that with this administration. You're seeing that with this Congress. And so bipartisanship is not dead. We think it's very, very much alive. And oftentimes where the best policy is made.
Yeah, that's a great observation.
And believe it or not, Katie and I probably agree on about 80% of things. And so
I might even give it 80. I might even give it 85, Ben.
There you go.
We're pretty close.
Yeah, I would discount that a little bit because you guys get along so well, but I think that is an anecdotal, kind of data point that shows there is agreement between the parties, right? At least in
100%.
healthcare and probably a few other areas as well.
Absolutely.
We're a good way into the new administration, and I want to get your view on how things are different, how they're the same, and maybe you can just comment on, generally, and then we can get into some specific issues.
Yeah, I'm happy to start. I think, and this as it pertains to, I think, healthcare and healthcare tech, in particular, this is an administration that is really leaning into founders, CEOs of healthcare tech. I think you've seen that in July, there was a whole exercise about how do we empower patients with their medical records? How do we make things easier for individuals to navigate with a very complicated healthcare system that we have in the United States? And so you've seen companies make pledges about how they are going to truly be interoperable and how they're going to not information block. And I think we've yet to see some of the fruits of that labor. But I think what's really amazing is that the administration has gotten companies across the healthcare spectrum to make pledges to work
so
with
Katie,
one another.
I think you're probably referring to the event that took place, I believe, July 30th.
Yep.
At the White House, where they brought in a bunch of companies, made pledges to work together to improve interoperability. So one question I had on that is we've seen a bunch of efforts on interoperability. You've got TEFCA, Carry Quality, Commonwealth, some of these other kind of just groups that have gotten together that have pledged to improve healthcare interoperability, which I think is bipartisan and everyone agrees should happen. But we've also seen kind of a series of these announcements, and I wanted to ask the two of you, how much of this is politics or political theater, and how much of it is substance, and kind of, what evidence are we going to look to over the next few months to see that some of these pledges have come to fruition?
I mean, I think this is an area where it very much feels like a continuation from one administration to the other, specifically around interoperability. Right. It's a conversation we've been having for a long time. And so, it is an area where I think we're going to see some progress. So far, though, it's been a lot of carrots and voluntary agreements and not a lot of sticks. And, we have not seen from the last administration or from this administration a real effort to ask the hard questions where there are bad actors, where there are entities that are seeking to create a moat around themselves and not share information, how to break down those barriers.
Yeah.
And so
I noticed, talking about sticks, Ben, there was a mention of the $1 million per violation penalty, and kind of like showcasing the violations, which, government agencies like to do from time to time. Are we going to need to see some high profile enforcement actions to see some forward momentum in this area?
I think we are. I also think this is an area where congressional oversight hearings, putting a spotlight on where there are bad actors in the system and really making that public and having a clear message on why that is bad for patients. I feel like we're making progress, but there's still a ways to go before we truly have interoperability.
I also think we hear this a lot from the smaller healthcare tech guys, right? I think that they haven't necessarily always had a voice here in DC, although Ben and I have been doing that work for a long time. They haven't been traditionally the folks that are going to the Hill in the White House. I think you're seeing a change in that where the
Right.
smaller guys feel more empowered. But I don't know that necessarily 5-10 years ago that a smaller healthcare tech company felt like they had a roadmap or a pathway, whether it was for reimbursement or whether it was to connect to a larger EHR. I don't know that you necessarily saw them feel empowered. I think there is a
So, and you're
moment where,
feeling that like some of these efforts are giving them that sense of empowerment, or
yeah,
kind of purchase or buy-in into that system.
yeah. And this administration wants to hear
And
directly
you
from
both
the
agree with that.
CEOs.
I'm just noting that Ben
Yeah,
is nodding.
no,
Yeah.
it feels like the playing field is starting to become a little bit more level. I think to Katie's
Right.
point, there are small companies that had issues with maybe some of the big EHR vendors, but were scared to raise them. Folks were scared about retribution or what that would mean for them in the market. I think that's dynamic is starting to change in a helpful way.
And would you credit the administration for that, or would you credit that plus other factors, Ben
Ooh, let's
or
hear
Katie?
Ben.
I mean, for continuing the Biden, I think it's part. I think it's, I think, like I said, this is an area where the Trump administration feels very similar to the Biden administration. I also think, though, it's the innovators and not just the healthcare tech, but the end users, the hospital systems that want innovation, who are willing to kind of help push the envelope and break down some of these barriers.
Yeah, awesome. Let's use that to get into AI. We can't have a conversation without AI, like talking about innovation and improvements. Obviously, AI has a ton of applications in healthcare, both on the clinical side and on the administrative side to, improve diagnosis treatment, but also improve administration, payment efficiency, all kinds of things. So what are you seeing? I know there have also been some big announcements from the White House and discussion in Congress on AI. How do you see policy developing to promote or not AI in healthcare?
I mean, I think on the AI front, originally I was a little nervous that that Congress would move to regulate something that Congress didn't necessarily understand. I think and I think this is actually to leadership on both sides, on both Democrat and the House, and this started last Congress. It's actually Kevin McCarthy, former Speaker of the House, was really big into doing educational tours because I think he felt like there were members on committees of healthcare jurisdiction or committees of financial services jurisdiction that were going to move in a direction that could be prohibitive of AI. I think we've moved off of that a lot, and I think that's really great. The reason I do is because I think it's industry by industry. You have to really understand that the use case for something in financial services versus the use case in a physician's office, for example, or for a health insurer is really different. And in a lot of cases, healthcare has been using AI for a long time. We just didn't necessarily give it that name. And
Right.
so what I've seen from Congress is a do no harm at the moment, and I'm really proud. Sometimes I think we work to regulate a thing before we fully understand it.
Yeah,
And that
and
can be
you
very
wouldn't
dangerous.
see like Congress moving more in the direction that the EU has with a very detailed prescriptive AI regulation. That's what they do is, Europe tends to regulate privacy considerations more and be more careful about tech and kind of monitor big tech more. Do you think there's any, the US tradition is not that. So like comment on that for a second.
Yeah, I think in the near term, no. And I think it's one of the reasons why, the US has most of the leading AI companies are based in the US, and I think that's part of it. It is
Right.
that innovative environment. I do worry a little bit though that we're like a few bad use cases away from Congress taking unhelpful action.
Right.
And, so I think that is something that we're very much watching. We saw it a little bit pop up where there's some press reports about how insurers were using AI. There was some pretty quick backlash on the congressional front. And so I think this is an area that it's a wait and see. It is an area, though, where it's a big difference in approach. I think the last administration, with respect to using AI in the federal government space, was moving very slow and wanted to focus on guardrails, whereas this administration has let's do stuff and kind of figure it out as we go. And so not saying there's a right or wrong here, but it is a very different approach to adoption of AI.
But I also think that might be based on the folks that are internal now to the agencies. I think you're seeing a lot of chief technology officers inside agencies such as HHS or CMS that really have a background in technology, not even necessarily a background in health. And so I think some of those folks have been really empowered to drive how do we move forward in the tech space, in the federal government space, especially at the healthcare agencies.
So you're seeing kind of more of the presence of industry or health tech executives in the agencies. So that goes to your point earlier about kind of bringing in more people who are in the tech space and, kind of innovators. Are you also like at that White House event? I know there were a lot of big tech companies. Were there little guys there as well, smaller companies?
There were.
Yeah.
There were, we had clients there, and of various sizes. And I think that is really encouraging to me that it's not just the big, we all know the big names in tech in general, not even necessarily in healthcare tech.
Right.
And I love the outreach. And this is really, kudos to the Office of Public Liaison. This is really outreach from the administration to folks who traditionally maybe haven't had a seat at the table, which I think is really encouraging for the technology sector.
Okay, cool. So, hey, I'd like to zoom out a little bit, maybe touching some of the policy areas which we're seeing more in the news, like that are happening, things that are happening at the departments, HHS, CDC, NIH, where there's news about big cuts at CDC. And let's start with CDC, and maybe then we can get into CMS and HHS more broadly, because CDC is where there's this data modernization initiative that's been going on for a few years. And I think that is directly relevant to a lot of tech companies in this space that are looking to get better reporting, better use of data so that they can apply their tech and achieve all the results and outcomes that they're seeking to achieve. So maybe you can comment on, while on the one hand, we have this move to promote innovation and get folks involved and promote interoperability, at the same time, there's this cognitive dissonance that, where you read the stories in the media and you see, the cuts at a place like CDC, including arguably some of the folks working on these data initiatives. How do we reconcile that?
Ben?
Want me to start? I'm happy to start. So, obviously, there are a lot of politics at play, right? The administration, House Republicans have proposed cutting CDC by 40%, a lot of focus on vaccines, a lot of focus on public health. I will say, though, if you go a couple levels deeper, there's still bipartisan support for data modernization. And even in the House funding bill, which slashed the CDC, it does fund the data modernization, which I think is a recognition that we have to make better use of that public health data. And I think COVID was a great example where the systems weren't prepared and there was a lot of investment in modernization. And so far, that data modernization has remained bipartisan, while the CDC overall, I think, is really struggling. And, I think tomorrow the former CDC director will be testifying about the politicization of the CDC and the vaccine decision-making. And so lots of fireworks, but at least
CDC
so far,
will be back in the news big time tomorrow.
Indeed.
Yeah. And a little bit on that, I think it is no surprise, there shouldn't be a surprise to anyone that this is an administration that likes to move quickly. And they're not afraid to break things, right? And sometimes it is that disruption that allows you to restructure in maybe a positive way. I think that there are, in any administration, there are going to be things that I personally like or dislike that's going on at any given agency at any time. But I don't inherently think that changing the structure, changing the value proposition for an agency is necessarily a horrific idea. I think it's super disruptive, but it could lead to a positive outcome in the end. I think in DC we get very entrenched in keeping everything the same, and it stays the same for decades and decades and decades. But I don't think questioning whether or not something should exist and then trying to do something about it, I don't think it's a terrible idea. I do think cutting funding for
What
research.
do you think, Ben? Is that a terrible idea to challenge the status quo?
No, that part I'm fine with, although maybe we found the 15 to 20% where we disagree here. I think the questioning of public health authority and the science has gone way, way too far. And so I think reorganization, yes, doing things different, yes. But some of the decisions where it's HHS stepping in and overruling, the established process and science at CDC, I think is a concern.
Yeah.
I think that's
Okay.
fair.
There we go. We're back.
Let's step back to the data part and let me ask another question on this. So after COVID, we had this data monetization effort. A couple of questions. Did things get better at CDC, like the reporting up of data from the states and localities? And then is there a risk with some of the changes that CDC is going to backtrack, that infrastructure progress that's been made might suffer or backtrack a little?
I mean, I think what's really challenging about reporting is the way that states report their data. Every state, every hospital, every entity that has to report public health data, they do it in a different way.
And that
so
goes
what
to
I
the
think,
interoperability concept a bit as well.
100%. What I do think is that what happened at the CDC is that they invested in technology infrastructure that allows them to receive data in a lot of different forms that they previously didn't have. And so I think that got better. I think and not that I want to push things onto a state level, and I know how burdensome this can be, especially for hospitals, but I would say that we probably need investment on a state level, regardless of the infrastructure that we have at the CDC, to make sure that the flow of data is equal for states across the United States. I think we could do a better job at that.
Right.
But that would be going state by state and making sure that we're making that investment.
Yeah, I think the two most promising things, we're no longer seeing the CDC try to build its own in-house software, and they're turning to the private sector.
Okay.
And then we're no longer seeing the CDC try to operate every program with its own separate data silo, right? Just breaking some of that information down so you can share, chronic disease data and epidemic data and all
sharing
have it flow
across the agency
to one. Yeah, and so
which is actually way more complicated than I think people really understand. The types of agreements you have to have in place when you decide to chat as a federal government is actually quite extensive. And so we saw a lot of that break down over COVID, which I think is a positive. How do we get ASPR and HHS and CMS and CDC all talking on the same platform so that we can share vital information?
Yeah, hopefully those initiatives will continue. We can keep making progress. Because I think a little bit kind of like the data is to health tech companies as basic science is to life sciences companies. It provides kind of a fertile ground for innovation, standardization, things that provide the infrastructure and support for those industries. That's the way I see it.
I feel like in healthcare, at least on the federal government side, and you see this in other sectors too. I would use IRS as a very good example, although they're pushing forward with a number of tech going forward. I think that there is a perception, and I think it's a true one. The financial services sector has been using a lot of this technology that I think we're now applying on the federal side in healthcare for decades, and we're behind, and we shouldn't be.
Right.
I think in earnest, the folks who have the technology background and now sit at those agencies, I really hope we move forward with modernizing our healthcare infrastructure on the federal level, and I think it could really be helpful on a number of fronts.
Yeah. The cuts to NIH and basic science, like what kind of impacts do you see that having? I realize we're kind of getting a little far afield, but I'll bring it back.
Do you want to go, Ben?
I mean, yeah, happy to. I think we'll have to see how it plays out, right? Like so far, Congress, House and Senate have rejected the big cuts the administration has called for. But I think, there is if you look back over time, right, a lot of the NIH innovation has then led to the private sector advancement. And as we want to try to build particularly, a U.S. biotech-based economy, those NIH investments are really the foundation. And so far, I think there is stronger support on the congressional side than from the White House, but we'll have to see how it plays out. I think the interesting thing about NIH, the funding goes all over the country, and so every congressional district is impacted by NIH funding. And yes, there are always examples of crazy studies you could throw out that might lead to the public kind of questioning.
It's more easy to politicize the research, I think, than it is to politicize information sharing in health tech, right?
Yes,
absolutely.
It's a cleaner, less partisan issue.
Yes.
But there is tremendous bipartisan support on NIH.
Yes.
And in a lot of ways, like I think we are a leader in AI, our biomedical research is incredible, and we should continue being first in class. I think when we talk about competition particularly with China, this is an important area of investment. Again, I'm going to make my CDC argument until I'm blue in the face. I don't think it's a terrible thing to question dollars going out the door. How are they being used? Are they being used appropriately? I think knowing the details of that is really important, and I think most institutions are really good stewards of their dollars, and I think they come to that research in earnest.
Yeah, and I think the counterpoint there that we've heard maybe from the other side is that yes, accountability is good and questioning the status quo, but there has to be a good empirical systematized way of getting that data, processing it, and coming to conclusions, and then taking kind of like rational, reasonable steps based on that. And
yeah. I also think that there is likely technology, and there isn't likely. I know there is technology out there that could help us have a better picture of what we are researching and who else is researching that issue, so that we can share information in a way that all parties feel comfortable with.
The data is totally there now. It's a matter of managing that.
It's got to be unlocked.
Yeah, another use case for AI. I'm sure it's already being done, and we'll see some of the emerging groups doing that.
I think it's done, but like in small disease silos, right? So you have like disease states that probably do a phenomenal job and have some type of technology where they share information. I really think if we're using federal dollars, we probably should have something across the board that shares the research information in a safe way. Obviously, making sure that privacy is of the utmost importance, but I think that there's a way to be better stewards of those dollars by talking to one another.
Yeah, and across NIH, not just at every institute and center.
Yeah.
Right. Yeah, cool. Hey, so let's talk about CMS a little bit. And we can't leave the show without mentioning the One Big Beautiful Bill Act and what's going on with that at CMS. Is there's some appropriations for some that we've chatted about for some rural funding that can improve infrastructure and information sharing and things like that. Maybe you guys can just comment on that, going on with that, and what's the promise of that? What are the challenges with that?
Well, those dollars are going to go out quickly out the door. There was an announcement this week from the White House and CMS on their timeline. But the idea here is it's a rural investment fund. It was part of the One Big Beautiful Bill. And these are real dollars that are going to go out to states, mainly governors and the top of their health agencies. The requirements this isn't just like a one-time kind of fund to shore up your hospital. It is, how do we invest in innovative tech that actually helps us sustain our health care system? And so you are seeing states and in partnership with the federal government release RFIs, RFPs, requesting companies to make pitches on how they could be a part of the health ecosystem in those states. And I think that's super encouraging.
So, Katie, do the states have a lot of leeway in how to use those funds?
Yes, with a lot of encouragement from CMS on, don't just let this be a one-time investment. Really think about what critical infrastructure could be helpful. Really look at healthcare tech in your state. And so it's been interesting to see what clients get what RFPs. And it's been big and small, which I think is very encouraging.
Yeah, I mean, two things. One, it's a large amount of funding, small compared to some of the the cuts, right? So there's still going to be a lot of hospitals and health systems that are feeling the pinch from the one big beautiful bill. But if you are a health tech company or you're working with health data, now is the time to be talking to states and looking at where you can do pilots and where you can move the needle on innovation.
And
Okay.
talk to your health systems in your states that are struggling. And I think, Dan, like, you probably have the most like direct contact with this. Like, you know what it's like when you're at Health Catalyst, like, you know, what technology like that can do for the finances of a health system that is
Hmm.
struggling. And so, working with those health systems in those states is going to be vital to that as well.
So there's a lot of activity at the state. So folks should look at the state, see if they can get in,
Yeah.
participate in some of the RFPs. Do you have a sense yet of which states, if any, are kind of going to lead this effort or be looked at as models?
So the funding, half the funding gets distributed equally across states, and I think
Hmm.
states have until November 4th to submit their plan to CMS. And so each of those plans, I think, is going to be a little bit different. Some states, to Katie's point, have put out RFPs to solicit feedback from industry. Others are kind of on their own putting together their plans. And so I expect we're going to see 50 different blueprints on what this is going to look like.
The great state laboratory experiment. Okay, so we'll see some good things emerging and some
Yeah.
not so good things or
Always.
not useful. Okay. So let's zoom in a little bit now into CMS. So back on this topic of ambitions versus execution, because CMS has also had cuts, and maybe you can comment on that. They've got a lot of goals, and maybe are struggling to keep some of the people around to execute those things. So what are
Ben,
some of the
Yeah,
things?
I
Yeah.
mean, I
you can be
think
critical and then I'll follow up with.
I think it is always easier to issue an executive order, to write the press release, to hold the event, than it is to follow through and issue the regulation and make the change. And some of that is the
And
amount of
by the way,
things.
I admire those folks who write the regulations in
Yes,
the Federal Register. That's a lot of work.
it is hard work that happens behind the scenes. But I think they are it's a lot of change at once. And so, I don't think they have the staff in place to really move forward on all of these things at the same time. And so, we'll see pieces start to fall into place. But I think the cuts that they made to personnel are a huge factor. CMS, I think, took less cuts than some of the other agencies, but it is
Right.
still a factor. And if you look across HHS at the political level, there are still vacancies all across HHS. Some are waiting on Senate confirmation, and some positions haven't been named. And I think that does have an impact.
You can blame the Democrats for the Senate confirmations.
So what's your view, Katie? Do you think do you feel like CMS is going to struggle to meet some of its objectives, or are they going to get back on track?
I think this is an ambitious admin. I actually think Dr. Oz is a great person to have at the helm at CMS.
Hmm.
I agree with Ben. They have some hiring to do. They have some really phenomenal people there, people that were in Trump 1, and people we've worked with for a long time. But more bodies would be helpful, and so I think you're going to see some of that. The hiring office is certainly a busy place. I also think they're looking to find the right people for the right positions, and some of those people are non-traditional, which again I don't think is a terrible thing. So I think it's both a lot of ambition, some really good ideas, some not so great ideas, but they certainly need additional firepower over there, which I think they're working pretty hard to do.
It does
Terrific.
seem, though, like Dr. Oz has a lot of running room, that the secretary focuses on MAHA and some initiatives he wants to move forward. But I think in many
Hmm.
ways this CMS has more latitude than previous administrations to move forward.
Great. Yeah. Yeah. There's a lot of work and a lot that goes on out of the glare of the spotlight, that
Yeah.
some of these department heads get in the news cycle.
I also
So,
think
yeah.
at the beginning of any administration, if you're good at your job as at the top,
Hmm.
you host a lot of listening sessions. You do a lot of roundtables. This administration continues to do that. And I think Dr. Oz is very quick to say what he doesn't know, which I think is a sign of a really great leader. But he's talking to folks. He's out there. He's meeting with industry on a really regular basis. And I think that is a very helpful place to start if you have an ambitious agenda.
Cool. So if you're a health tech CEO, maybe emerging, maybe one of the smaller or medium-sized companies, what should you do? You should look at the RFPs, look at what's going on the state level, just to recap, look at some of the initiatives, maybe participate in some of the initiatives that are going on at these agencies, get a little visibility, provide some input. What else should folks think about who are CEOs or leaders at these companies?
I mean, one basic thing that every CEO should do or every company should do is get to know their members of Congress. Ultimately, they're there to represent their constituents and constituent companies. You can certainly work with a firm like ours, but a lot of this you can do on your own, sitting down with congressional staff and talking about the issues, because those congressional staff and members of Congress are hugely influential with the administration. The other thing is obviously participate in the RFP process, but also don't just look at HHS. There are agencies like the VA that is trying to tackle massive healthcare data challenges.
Right.
And so there are a lot of places across the federal government where there is good fit. And I think
could go on and on with that.
More
episodes.
We could do a whole episode on that.
I mean, yes.
But bringing solutions that are proven out in the commercial sector and bringing them to the government to see how they can be deployed, I think is the right approach.
Yeah, I love that. Yeah, and you might have a willing ear.
Absolutely.
In some of these with some of these folks.
I think people might be surprised how easy that is. Ben and I do a lot of obviously these are not our clients, but we do a lot of talking to smaller companies where you might have 1 or 2 employees, but a really good idea, and you're in the commercial market where we don't want to take your money. You're not ready for us, but you know who is ready? Your local member of Congress, your senator should know who you are. Their district director should know who you are, especially if you're domiciled or headquartered in that district. It is really accessible.
Yes, why not?
Easy.
Invite them over for lunch or go to their district office and drop by. Yeah.
And it doesn't matter what your political affiliation is and their political affiliation. If you are a business in someone's district, it's almost politically agnostic. It does not matter.
Right. Do you guys have any other thoughts on the administration and kind of where things are going with information sharing or
I have lots of thoughts
innovation?
On the administration.
I'm sure
he does. A lot of thoughts. Some shareable, some not shareable
exactly.
on the podcast.
No, I mean I think the interoperability, information sharing is going to continue to move forward and remain very much a bipartisan conversation. Unfortunately, I think some of the politics of HHS and RFK and vaccines, I think, are creating a big distraction where, I think members of Congress would like to dig in on some of these other issues. And hopefully we get there. Hopefully, as we get to the second 6 months here, it's a little bit more of a balanced conversation.
Things take a long time in the health world, policy and legal changes and just cultural changes in organizations too. So that's why we can have these long careers, right?
Exactly.
It takes a long time.
Well, it's been great. Anything else from you, Katie?
No, thank you for having us. This has been really fun. It's always good to talk to you, Dan.
Yeah, it's great having you. Thanks for joining, and we'll be in touch soon.
Awesome.
Thank you.
Thank you.
And that concludes our episode of Free Flow. Thank you for joining us today. For more information, please visit our website at orensteinlegal.com and navigate to the podcast page. Remember to subscribe or follow Free Flow on Spotify, Apple Podcasts, and YouTube so you never miss an episode or update. This podcast is for informational purposes only, is not legal advice, and does not create an attorney-client relationship. Thank you for listening.